Hello, it's Daniel Dada from St Jude's Clinic, and what I'm doing now is I'm going to talk to you about kyphosis and hunchback or Scheuermann's disease in this area. And you'll see that this gentleman here also has scoliosis. So the curve also deviates to the left of the center. And if we take a look at his spine from the neutral position, you'll also see then there's just a normal standing position. There's a very large bump on his back. Now, these pictures here can be quite graphic and a little bit unsettling, but I'm going to bring you a method of reducing this bump, and I'm going to show you how to do that via non-bracing and non-surgical means. Now, it's very important that we actually understand that the approach towards something as disfiguring as this type of presentation is typically done because of concerns with breathing, the chances of pneumonia developing due to decreased chest expansion, and also therefore poor exchange of bad air for good air. So what we have here is a pretty serious condition. This gentleman here was hospitalized 4 times in 1 month and has had repeated episodes of infection in his lungs. So what we're going to do now is address the curve, and we're going to see, where possible, how a reduction is made. So let's just take a look at this is from Scheuermann Rowe's Essentials of Skeletal Radiology, published by Williams and Wilkins in 1987. It's a terrific manual. I really enjoyed this book, but I'm going to bring a little bit of a correction here as to how we can apply this knowledge in clinical practice. And the reason for that is that rarely will we see an X-ray that will be able to take a very good view of the spine like this. The EOS films are probably the best films to take, as they will be able to reveal the lordosis, the kyphosis, and the lordosis down in here. So typically in Scheuermann's disease, you're going to have an increased lower back curve, you're going to have an increased thoracic curve, and you'll also have preservation of your lumbar lordosis, cervical lordosis commonly. For plain films, rarely do we get T1. So what I've done is I've created an extra line here as well that goes from the T3 vertebra, and also you're still using the T12 vertebra. So where these perpendiculars intersect gives us the angle of 36 degrees. I've actually created 2 more perpendiculars here as well, and that actually gives us a 40 degrees. So if you're using T3 to T12, you can add an extra 4 degrees to all of these values here, shown both for females and also for males, and as you can see that they are age dependent. So probably at around about the 30s and 40s in here, we're getting some sort of representation of what average is. So we're looking at around about that 40 degree mark there as well, 42 to 50 maximum, and we're looking in the males probably a little bit more so. Yeah, still around about the 40 to 50 degree mark in here as well. But if you're in the 70s, you're going to notice that your curve or your hunch is going to increase. So the maximum goes up to 60, the minimum is down at 32, the average is at around about 40 in there. So Jeff's curve is sitting at 110 degrees. Just to put it into context for you, this is a 110 degree curve when we look at it just from that position there. So this is a rather enormous curve, surgically warranted, and also at this stage in here you'd be considering some respiratory distress problems, and that's exactly what Jeff has. So now let's take a look at the next video, and let's take a look at Jeff's x-rays.